Hello, welcome to this month's Zoominar. This month, we're going to talk about our mid-back. Oftentimes, we don't think about thoracic spine consists of 12 vertebrae, but it has rib cage surrounding it. And we think that it's already supported. We don't have to think about the posture. We don't have to really worry about how it is, how we use them. But you're wrong. It's absolutely very important that we pay attention to this middle section. By having a good posture for this middle section, we have a good support of our neck and shoulder region. By having a good support or contraction of this middle section, we lessen the pressure onto our lumbar spine. So today, what we're going to run through is some of the bad postures, some of the supported postures, some of the things that we can use to help ourselves, and some of the tips I can give you to help you with how to keep your constant good posture. So let's go over some of the most common posture that we get ourselves into without knowing. Sometimes when you're actually looking at your phone or iPhone, iPad, you may think, oh, it's just a couple minutes. But this couple minutes turn into a couple hours, and couple hours turn into a regular posture without you knowing. If you often find yourself that you have to catch yourself, you have to shift your weights, you have to move around, you have to kind of rest on the back of the chair, or you have to rest in the front of the chair and lean forward, drop your arms and your shoulder onto the desk to kind of hold on to your upper body weight. You're constantly shifting for good posture. Well, that means you need to stretch and you need to find something more comfortable. Either you need to elevate your computer, change to an extension keyboard, monitor, something that would get you into a good supportive posture. Now, of course, when you're working, all you really need is your eyes and your fingers. Why move and contract more than you need to? So one of the newer recommendations, I ask patients to actually sit in one of the gaming chair, or if you could sit in a recliner and your screen is up top, then you could completely relax. The only thing that's moving is your eyes and maybe your fingers trying to move around. But of course, if you're swiping on a little iPhone or iPad, you're still confined into a small area. Sometimes people ask, well, what's the best chair? How about one of these that actually make you work a little harder for your back? It's good for your back. Sure, of course. These chairs are helpful, except you can't be in it for too long. Because when you're actually in this chair, you're forced to contract your back muscle. It makes the extra work. So I would say, sure, these chairs are good, but just use it for about an hour a day or 2 hours a day to kind of train your back. For long term, you'll have to do more stretches. Then people say, what about these posture shirts? Yes, they will be helpful. Of course, anything to help you keep your posture is good, except when you get used to it, then you're kind of back into your slumped over, slouched forward posture. So it's a temporary help, not permanent. Posture brace is also next level up. Now you have to lift things, you have to work in an environment, you have to constantly look forward and down. Then this brace may be helpful. Once again, it's temporary. A lot of time people tell me that after some time, the armpit region is not comfortable. And the ones that just holds up to your upper chest, which pulls your shoulder back, it's okay. It's not as helpful. People find that the bigger brace that goes around and wraps around your lumbar give a better support than just the one that actually holds onto your, pulls your chest back. Okay. So you do want to look for one that's a bigger, nicer brace that holds your entire back posture straight. And that is also a very good temporary help. Then we have people that thought about technology, which is great that you don't have to wear a big brace or a tight clothes. Well, these are also good. This is the same as back in the good old days, anything that you get used to. Like we used to have a screensaver that tells you to get up and stretch and move around. Well, it's a click of finger and then you can ignore it. These things they detect and then they vibrate. Well, after some time you get annoyed by it. And you could easily pull it off and turn it off and you don't like it anymore. So once again, these are temporary help, but not long term. They are all helpful to help you get into a good posture habit. And people ask, well, what about standing? I said, great, from sitting to standing or a tall chair, semi-sitting to standing. All these are a good way to change how you use your muscle. You can stand, put your foot, one foot up onto the box, and then you can shift your weight left and right. But how often are you conscious of your posture shift and your weight. After some time, you may be favoring one side. After some time, you may be sore and tired again. And then you forgot standing actually uses more muscle of your legs. Whereas when you're seated, you only use partial. If you don't stretch, you end up with more lower back pain and aches at the end of the day. And so all these are all temporary. People often ask me, well, what can I use to release all these mid-back, chest, in between shoulder blade muscle region? Well, one of my favorite answer is these nodule or spiky ball. I got mine from Aeromat, which is one of my favorite. They have the perfect nodule, round nodule that I enjoy quite a bit. And so online, you can see they have 6 inches and 7.5 inches. That's the most common size. If it's too big, it's harder to get into in between your shoulder blades, and it's harder to get that nice knot out of the way. Okay. There is a good book that came out probably about 10 years ago. I noticed that. Her name is Jo Miller. She has a great book that uses all sorts of ball. Of course, when it comes to the spinal region, rib cage region, I really like the soft spiky ball or the soft massage ball, air inflatable massage ball, because our spine is delicate. You don't want something too hard. You can easily push yourself out of alignment. So the key is change your habits and you'll change your life. Making habits come to a natural thing. Meaning, if you always have a good posture, you'll get used to it. Oftentimes, if you ask anybody who's gone through military training, they naturally have a good posture. But then when they get older or when they're not in training, they're slumped over. I have dancers, ballet dancers, they're perfect on stage. But when they get off stage, they're like, well, I'm off stage. I said, what's the difference? There's no difference. If you get used to the same posture, whenever you have to sit, stand, and walk, you keep your posture upright, relaxed, and balanced, you will have less problem as you get older. That is guaranteed, and that is preventable. Okay, so now let's go over a very simple exercise that I teach my patients to do. We call it holding your chest up. What does that mean? Now, holding your chest in a good posture means I want you to fully inhale and expand your rib cage. By doing so, your rib cage actually holds up itself, which expands the entire structure, and it actually supports your entire upper and lower body posture. So the very simple thing to do is just inhale 3 times consecutively without exhaling. It'll be like this. 1, 2, 3. Notice my chest naturally expands upwards and it just opens up. You will feel the same. If you don't, that means you have not breathed deep enough or large enough to expand your lung capacity, where your rib cage will need to actually expand itself. Now, by doing so, I don't want you to just quickly let go and drop your shoulders. I want you to hold there and still breathe in and out. You will notice that it's possible. You can hold your chest and breathe at the same time without having any disruptions. By doing that, your rib cage expands and holds in the right position. That'll ease up all that muscle that's attached to your neck and to the base of your skull, and also all the muscle that's going down attached to the ilium crest. This is a good way to remind yourself to keep a good posture. So try that as often as you can. When you find yourself slumped over, looking down, and you find that there's pressure in your neck and your back, all you have to do is take a deep breath 3 times, hold your rib cage, and then let it be. And this is where you should be, and make it a natural habit.
So, besides constant good posture, the next thing is you have to do daily stretches. Daily stretches for mid-back can be followed through my video online. And in this, you see this nice big ball, and it's called Daily Exercise for the Minimum. There's a more where you can click on, and in here we've actually divided and listed out. You have lots of things from strengthening to stretching, and once you jump to stretching of the spinal mid to lower back region. Stretch is really important, and it's really easy. You could do this anytime, any day, anywhere. All you have to do is raise your arm up. To stretch the mid back, you must raise your arm up all the way across to the other side. Okay? And follow the video. It's a short video where you can jump chapters and get to exactly where you wanted it. You can stretch a little bit further more. If you're not, just hold where you're at. We've shown how you can stretch more or you can stay where you're at. As long as you feel the stretch, as long as you breathe and relax. The key is your mental state of mind needs to relax so that your muscle will elongate and lengthen and relax on its own as well. Okay?
So the tip of the day, once again, these are my tips for my patients. Daily stretching. Why is daily stretching important? Daily stretching is almost like checking yourself. Brushing your teeth. When you brush your teeth, you know whether you have some soreness, achiness, sensitivity. Then you know soon there might be a problem coming up. When you stretch your left compared to your right, if your right is tighter, that means there is some buildup. There are some overusage during the day that you have to stretch it out. Now, atticus strengthening, it's probably once or twice, minimum twice a week. This involves elastic band or weight bearing. Okay, it's not super heavy duty weight bearing workout. This is building the muscle a little bit stronger than your daily usage needs. I recommend that you should be lifting to that one time heaviest bag that you're lifting so that there's no risk if you ever need to pick up something slightly heavy. Oftentimes, we injure ourselves during times where we're just trying to rush through something and we pick something up really fast, turn and twist, and there you go. A minor tear turn into a big tear or a chronic tear, and it becomes something swells up and you don't feel it till 2, 3 days later. Okay, constant good posture. This is the hardest, but also easiest. If you get used to it, it becomes easy and you don't even have to think about it. It just takes some time to practice. Once when you practice it, it becomes natural. And when it becomes natural, you don't even have to think about it. Balanced nutrients. This will take another long lecture, but we often know you are what you eat. This phrase is common. You have to think about what you put into your mouth. Is it more of the junk food or is it more of the healthy food? Okay. All your body needs nutrients. And the more we use our brain, the more that we'll need good nutrients instead of junk food. And lastly, regular spinal checkup. If you don't check your spine regularly, how do you know when things are happening? If you're not stretching, you wouldn't know. And if you're not checking, by the time you have a problem, it may be too late. So a lot of things can be prevented. It's like going to a regular dental checkup or taking your car to a regular maintenance. These are all things that you know you do often. And lastly, spinal checkup. How often? Twice a year, minimum, just like a dental checkup. Why not? If you don't check your spine, how would you know how's everything functioning? And don't always have to wait. If you feel something funny, go get it checked. Don't wait till it's really bad.